The fifth area of the mommy makeover is the labiaplasty. Very often, the length of pregnancy, the length of delivery, the weight of the pregnancy leads to varicose veins, leads to hemorrhoids, and leads to enlarged labia. And very often women get uncomfortable with labia that hang outside, labia minora that hang outside the labia majora. And so there are multiple ways of reducing the labia, but I feel the best one was invented by a friend of mine in Beverly Hills. He's a board-certified plastic surgeon, also a board-certified urologist, and for a guy that operates on people's private parts, he's got a great name. His name is Gary Alter, so he alters you. Anyhow, Gary came up with this technique, and the fact that he's a plastic surgeon led to what I think was a great understanding of tissue. The earlobe often looks very much like the female labia, and if you take a small wedge out of the earlobe and then sew it together, you can get a smaller and sometimes more attractive earlobe. Taking the same wedge out of a labia leads to minimal scarring, quick recovery, and no loss of sensation, and it also puts the labia back inside where you want it. The surgery takes about an hour when done correctly, maybe a little over an hour and a half. I've had patients go back to riding horses and having intercourse within 7 days. So it's not neither is it particularly complex, nor is it particularly a long recovery if done correctly. So labiaplasty is the fifth part of the mommy makeover. So to go over this again, what are the 5 parts of the mommy makeover? Correcting or at least dealing with hyperpigmentation on the face, which is known as chlasma, dealing with the multiple breast complications or problems that come from pregnancy, droop, deflation, getting large, having tissue in the armpit, which is called axillary breast tissue, the loose skin of the abdomen, the unattractive belly button, the stretch marks, the separation of the muscles, the stress incontinence, low back pain that are all corrected with an abdominoplasty, liposuction of the unwanted areas that either existed before pregnancy or came on from pregnancy, and finally labia reduction for those women whose labia gets longer and offends them. I've now articulated the 5 areas in the standard mommy makeover. That's it, folks. That's the mommy makeover.